Welcome to Mercy Medical Center's live webinar. Today we'll be discussing Human Papillomavirus, or HPV. Joining us is Dr. Sharon Bertroche, a Mercy physician at MercyCare Marion. After discussion, she will take your questions live. Submit your questions anytime during the discussion. Go to the window in the upper right-hand corner of your screen and type in your question. If you don't see the screen, click on the orange box with the white arrow. Your questions will be anonymous, completely confidential. So let's get started, Dr. Bertroche.
I'm Dr. Bertroche, and I've been in practice in the Cedar Rapids area for about 23 years. And I started trying to educate women regarding human papillomavirus about 8 years ago. But my interest in this area really started around 10 years ago. It was at this time that physicians were noticing a large increase in the number of patients having an abnormal Pap test. Well, what is a Pap test? A Pap test is a screening test for cervical cancer. Up until recently, women had annual Pap tests when they became sexually active. This was recommended because of the then known risk factors for cervical cancer, and they were being young. Cervical cancer is a cancer of young women, not older. You increase your risk of developing this if the younger you are when you become sexually active, and if you've had multiple sexual partners. The fourth risk factor is smoking. Years ago, though, we did not know why these first three risk factors increased women's risk of developing cancer. It wasn't until about 8 years ago when a virus was detected called Human Papillomavirus, or HPV. In order to fully understand the impact of this virus on society, I feel you first need to have just some general information about the larger problem of STDs in general. There are approximately 19 million new cases of STDs per year in the United States. And to put that in perspective, there are about 18 million people who have diabetes in our country. So more people are diagnosed with an STD per year than the people who have diabetes. 1 in 5 people in the United States have an STD, and of the STDs, 1 in 4 occur in teenagers. This is a chart that most middle school wellness teachers have in their rooms, and what this is showing you is how you can accumulate exposure to these diseases as you accumulate partners. And what this is showing you is if both you and your partner are virgins, meaning no genital contact, you are exposing yourself to one person's diseases. So, if each of you have had 2 previous partners, you are now exposing yourself to 3 different people's diseases. Look what happens when you get to 5. You are now exposing yourself to up to 31 different people's diseases. And, of course, you don't know who those other partners are. And one thing I try to stress to girls is that when a man ejaculates in a woman, that semen goes into the vagina, through the cervix, into the uterus, and basically inside your pelvis. So you now are exposing yourself to all of these different people's diseases inside your pelvis. How common are STDs? This slide here just lists the top diseases that we have. And in this list, there'll be, trichomonas is actually a parasite. It's just a nuisance. It doesn't cause any long-term problems. So we'll focus more on the other ones. HPV is a virus. Then underneath it in incidence is chlamydia. HSV is kind of confusing. That's herpes. And then gonorrhea is bacterial. So what I'm trying to show here is that the new cases per year vary between a virus, a bacteria, a virus, a bacteria, and so forth. But when you look at the total prevalence, which means how many people in the population have a sexually transmitted disease, the viruses move up to the top of the list. So HPV, there's 20 million cases. HSV, that number is 40 million. If you calculate out the percentages, chlamydia would be about 5 million, and then gonorrhea, 2.5 million. So the viruses, when you look at a prevalence, total people in the population who have the disease, the viruses move to the top because we cannot cure them. Gonorrhea and chlamydia, because we can treat those with an antibiotic, they move lower in when you look at the total currently infected. There are really two main types of sexually transmitted diseases. Bacterial infections, I already mentioned chlamydia, gonorrhea. There's syphilis, bacterial vaginosis. Trichomonas technically is a parasite, but we do treat it with an antibiotic. The viruses, there is no cure except vaccines. Hepatitis B, there was an outbreak of that in the 80s, and a vaccine was developed, and all of the young people should now have been immunized. But it's important for parents to check and make sure, in particular, that their teenagers have had 3 vaccines. We changed the time when we vaccinate, and so some teenagers were missed. AIDS, most people are aware of that, genital herpes, and then HPV. There is no vaccine against herpes. HPV, there is a vaccine, which we will be talking about later on. What this next slide is showing you is why have these diseases become more common and so forth. Well, back in the 60s, we had what we called the sexual revolution, and that occurred because of birth control pills. Women didn't need to worry about getting pregnant as easily, and so they became freer with their sexual activity. Well, back in the 60s, we had mainly bacterial infections, which were syphilis, gonorrhea, and chlamydia. Again, those could be treated with an antibiotic. Well, then in the 80s, we saw an increase, or we first noticed AIDS, and we saw an increase in hepatitis B. These are viruses. Again, you can't treat those with an antibiotic. Well, those first 5 diseases are spread through the ejaculate, and that's when the safe sex message came out. You can wear a condom, the ejaculate goes in the condom, you throw it away. Well, then the 90s come, and we get herpes virus and human papillomavirus. The difference with these 2 viruses is they're spread by skin contact, so the condom is less effective at preventing the spread. So we don't use the term safe sex anymore when we're talking to young people. We use the term safer sex. We still want them using a condom because it helps with those first 5, but it isn't considered safe sex. So what is HPV? It's very common, and it's spread through sexual contact. HPV can affect the genital area, the mouth, the throat, in males and females. And when we talk about genital areas, we're also talking about the rectum. It is not completely prevented with a condom. HPV can affect areas that are not covered by a condom, and so that's why herpes and HPV, the condom is less effective. Most are infected, do not know it, but can pass the virus on during sex, and there is no cure for HPV. HPV is associated with many types of cancers, which are shown in the next slide. Almost all cervical cancers are caused by HPV. I've seen in some studies that have even said up to 99.7% of cervical cancers are due to HPV. It can also cause the other cancers that are listed below, even though, like with vaginal cancer, HPV causes 70%. Vaginal cancer is not a common cancer, and so the absolute number of people with it is not very great. Same way with penile cancer, even though 40% are due to HPV, it is not a common cancer, so the total number of patients who have that is very small. Mouth cancer is on the increase, and that number I will be talking about a little bit later. Here it says 25% of mouth cancers. I recently did a talk with some dental professionals, and studies I was looking at there said it will most likely be 50 to 65% in the near future. Of interest, more people die of mouth cancer per year than who die of cervical cancer. It's almost double. Approximately 20 million Americans are currently infected with HPV. half of those are between 9 and 24. And again, put this in perspective of the 18 million people who are diagnosed with diabetes. So more people in our country currently infected with HPV than who are currently diagnosed with diabetes. About 6 million people will become infected with it per year. Over 50% of sexually active males and females will have HPV at some point in their life. I've seen some studies that have estimated that to be 90%. One of the strongest risk factors for becoming infected is young age. How do you test for HPV? How is HPV tested? And there's over 100 strains. This gets kind of confusing. There are actually, I think, almost 120 strains of HPV. Some of the strains cause warts on your feet, your fingers, and so forth. I had a girl come in from a small community, and she said that the girls were afraid to go barefoot at the swimming pool because they thought they were going to catch HPV. Well, what they were confusing is the strains of HPV that cause warts on the fingers and toes with the ones that cause problems in the genital area. So those are different strains. There are 2 strains that can cause genital warts. Those are HPV 6 and 11. And then listed below are the ones that can cause abnormal pap smears. The ones that we're most concerned about are the ones that are high risk for causing cervical cancer. HPV 16, which is on the in that high risk list, causes or accounts for about 50% of all cervical cancers, and 18, 10 to 12%. When you look at the data for oral cancers that are caused by HPV, HPV 16 accounts for almost 100%. So HPV 16 is the biggest culprit. The NIH estimates that 50% of women who have cervical cancer have never been screened. Who end up having cervical cancer have never had a Pap test. And again, I really want to stress the fact that the only test for HPV is the Pap test. And one thing I try and tell teenagers when I'm giving talks is that say a girl is out with her boyfriend and he says that he is tested and he's clean. So he's a clean guy. He's had sex with other girls, but he's been to the clinic, he's tested, and he's clean. So what has he been tested for? Most of them have no clue, okay? What he would have been tested for is gonorrhea and chlamydia. And on occasion, HIV. There are really specific guidelines that will trigger them being tested for AIDS. That is not a standard screening test that's done. So if he goes to a clinic, he's tested and clean, it's for gonorrhea and chlamydia. There is no test on the guy for HPV. So it's really important for young women to realize that the only clean guy for them is a virgin. If he has been with any other woman, he is a potential carrier of HPV, and they have to decide, is he really worth the risk? So the Pap smears are the only test to check for HPV, and there is no test in males. 90% of HPV infections will cure spontaneously without any treatment. 10% can progress on to cancer. Now, when we first started having information about HPV come out about 5 years ago, I would read studies and they would say, well, so HPV is not a big deal for women because 90% of them will clear it without any problem. Well, what about the other 10%? So if we're talking, that most of our young girls who, teenagers and young adult women who are sexually active will get HPV, and out of that population, 10% of them are at risk for cancer. To me, face-to-face with the patient, that's significant. But the studies would say, oh, it's not a big deal because 90% won't have a problem. But that 10% is huge if that's you. Now, the next test, if a patient has an abnormal Pap test, depending on how abnormal are procedures like colposcopy and LEAP. Now, when I'm talking face-to-face with a young woman and I'm starting to have to talk to her about having other procedures done, none of them are happy. And so it's a whole different story when it's you who's going through it than if you're in a large statistical study. So how can you protect you and your child? Well, there is a vaccine called Gardasil and another one called Cervarix. Now, Gardasil is a series of 3 vaccines. You get your 1 shot initially, and then in 2 months, and then in 6 months. There is an accelerated rate that you can do for girls where it is the initial vaccine, 1 month, and then 4 months. So particularly if you have a daughter who's in college and you're trying to arrange the vaccine around her when she's home from college, there is an accelerated rate. Okay, but in general, it's 1 month, 2 months, and 6 months. This vaccine will help protect against the 2 strains of HPV that cause genital warts and 2 strains of HPV, HPV 16 and 18, that account for about 70% of the cases of cervical cancer. Now, I'll have moms who will say, well, I don't want to give this vaccine to my daughters because that will give her permission to go out and have sex. No, it doesn't, because this isn't 100%. I mean, this is a vaccine that is to prevent cancer. So this is a cancer-preventing vaccine. And if we had a vaccine to help prevent breast cancer, everybody would be lining our daughters up to get this vaccine. Well, this is no different than that. It just happens to be that this is, something that pertains with sexual activity and so forth. Now, I also have moms who will say, well, my daughter, why is it recommended between the ages of 9 to 26? Well, that's because that's when the study, the company did their studies on the vaccine. So when a vaccine comes out, they can only get FDA approval for the age group that they did their study on. And so when Merck came out with, when they were doing the studies of Gardasil, they had to pick a population. And so they were picking the population that was at highest risk for developing HPV. I am assuming down the road that it will also be approved for older age groups, but right now it's to age 26. So why should you get your 9-year-old vaccinated? Well, you want to just make sure that they are vaccinated before exposure, and this is no different than any other vaccine. You don't immunize your child against measles after they've been exposed. You immunize them against measles before they get exposed to measles. So you want to just make sure that they are vaccinated before they become sexually active. And there are some really scary statistics as to age group of kids when they become sexually active. I ran across this CDC survey from 2007 showed that 2% of children under the age of 11 have had some sexual contact. 7% of our 12 to 13-year-olds have had sexual contact, 28% between 14 and 15, and then 40% between 16 and 17. The biggest group, the biggest increase in number of kids having sexual activity were between our 12 and 15-year-olds, okay? So that is often the age group where they are deciding, are they going to be sexually active or are they not? You do need to receive all 3 doses before you are protected. In the study population, all the vaccines were given within a year. They did not meet just the exact 2 months and 6 months. If you say you get 2 doses and then you realize 2 years later that you forgot a dose, you do not start over. You just give them the 3rd dose, okay? And this will help protect against genital warts, vaginal, vulvar, and oral cancer. Now, the company cannot promote it for preventing anal cancer, but there are studies out now that it does also prevent anal cancer. And there's a high percentage of anal cancers are now also attributed to HPV. I tell people that HPV likes soft tissue like the inside of your mouth. So if you can think of it this way, that's why It likes to go to the mouth with oral cancer, the cervix with genital cancer, the rectum with anal intercourse. Cervarix is also a vaccine that's out. It's a 3-shot series given in the same time frame as the Gardasil, 1, 2, and 6 months. It will help protect against HPV 16 and 18. Pretty much the same age group, 10 to 25. It does not protect against 6 and 11, which cause genital warts. So how can you protect your child? Talk to your kids about HPV and don't joke. You know, when a lot of us were growing up, you could kind of just joke around, throw your kid a condom and say, there you go. The diseases out there are, for one thing, much more prevalent. So the chance of your child getting them if they do have sex is much greater. And there are really very significant consequences if they do develop them. So this isn't a funny matter anymore. Young adults are more susceptible to infection and more likely to have multiple partners. And one thing is the reason they're more susceptible is they also have sex with riskier partners. The only way to be 100% sure you don't get HPV is to abstain from all sexual contact. So abstinence is truly the only 100% way to protect yourself. And you need to talk to your children about the dangers of HPV. Since I put these slides together, I also reread some information that I had regarding the link of oral cancer to HPV, and I just wanted to just briefly read some excerpts from some of the studies that I found. There was a study in 2007 from the New England Journal of Medicine, which is one of the major medical journals, that found that younger people with head and neck cancers who tested positive for HPV were more likely to have multiple vaginal or oral sex partners in their lifetime. Now, in some studies, again, they'll kind of spin it kind of interesting. They'll say, well, the group of people in the United States who the rate of head and neck cancer is increasing the fastest in currently are in on non-smoking white male young adults, okay? So they're seeing that is the group where head and neck cancer is increasing the fastest, and the majority of them have no mouth lesions. They come in with just a metastatic lesion to their neck. Now, the study will say, but on the optimistic side is about 85% of these young men survive. Well, what happens to the other 15%? Okay, now if I have my 20-year-old son and he comes home with a neck mass, has to go through radiation treatment, that alone is stressful enough, but then 15% of them don't survive. You know, so when you're looking at these population studies, it's a whole different ballgame than if that is your young adult that you're having to take in for treatment and so forth. I'm just looking through my study here quick. I had them marked. Oh, and in another study, when they found these head and neck cancers, when they did remove their tonsils, 70% of these young men had HPV in their tonsils with no identifiable mouth lesions. So what's happening is with oral sex, HPV is getting spread metastasizes to their neck. This is another one. Head and neck cancer will cause over 8,000 deaths, killing roughly one person every 24 hours. And there's 36,000 new cases a year of head and neck cancer. Okay, here's another study. In people under the age of 50, HPV 16 may be even replacing tobacco as a primary causative agent in the initiation of head and neck cancer. Now, HPV 16 is in the Gardasil and Cervarix vaccines. So when I'm telling my young males, and in my classes that I'm giving talks to now, you do not have oral sex on any girl until you're vaccinated, okay? Because we have no clue, you know, who's going to get this and have it progress to cancer. So I'm just telling them, hey, no oral sex until you're vaccinated. I did talk with our insurance gal in my office, and she said most insurance companies are currently covering HPV for boys. And I also checked with our current insurance companies, you know, through Mercy and so forth. This is a Mercy webinar. I'll throw that out, that it is also covered for boys. So now we can take questions.
Well, thank you, Dr. Bertroche. To remind you, your questions can be submitted from the box in the upper right-hand corner of the screen. We will stay online until all your questions have been answered, including any questions that you may have about other STDs that Dr. Bertroche has mentioned. So our first question, while we're getting things set up, the vaccine hasn't been out for very long. How do we know that it's safe?
The vaccine, they started studying the vaccine about 10 years ago, and they did, you know, like about 5 years of study, and now it's been out for 5 years, so it's actually been around for quite some time. Studies are ongoing. There have not been any problems associated with the vaccine. So it has been studied in a large population group. And again, studies are ongoing as we speak, and that's the way it is with any vaccine that comes out. So the studies don't end when the vaccine starts, and so there have not been found to be any problems associated with the vaccine.
Related to that, we have a question asking about 51 deaths that have occurred from Gardasil. Dr. Bertroche, do you know anything about that study?
Okay. Those deaths, I'm not familiar particularly with that number, but I did research on the vaccine, and deaths have not been confirmed with the Gardasil vaccine. There were some girls who passed out after receiving the vaccine, and it was felt due to when teenagers come in for their vaccines, they're getting numerous vaccines at the same time. And sometimes people get very nervous, and even with the MMR, which is a standard vaccine, people tend to pass out. And we now recommend having them stay in the office for 15 minutes after they receive the vaccine. Now, I mentioned the pain, and there's a study here on the vaccine which showed that when they when people rated pain from the vaccine versus a placebo vaccine, the pain was really equal. But so there are no confirmed deaths to HPV. And if you think about the risk of cancer, again, if there was a vaccine to help prevent breast cancer, we would, you know, be lining our daughters up to receive that.
So just to confirm, there are no other major side effects that have been shown other than really the pain at the time of the shot. Is that right?
Tell me that one.
Major side effects. So really no other major side effects.
The major side effects that they list in the information on the vaccine were pain and swelling, which is really listed. In fact, I even have it in front of me, pain and swelling at the injection site. And if you compare that to pain and swelling that was reported in the placebo group, there really wasn't much difference. The other thing that was listed is headaches. But when you look at the bottom again, the rate of headache was no greater than in the placebo group. But headache was also one that people did report.
I have another question. Can HPV be transferred from different regions via auto-inoculation? And you may want to explain what auto-inoculation is.
Okay. Well, that would be I would need a little clarification of what they actually mean by that.
Okay, we'll wait. Perhaps
we'll
the
wait with
person
that
that asked the question will get back to us later.
Okay.
Another question. If a person already has HPV, can they still receive the vaccine, or would it not be effective at all at that point?
When they did studies on the vaccine, they found no one that had all 4 strains of the vaccine at one time, okay? So if you know you have HPV, we don't know which strain you have, and there are several in that high-risk category. So say you even had HPV 16. When we get a report and they tell us you have a high-risk strain, they don't tell us which strain you have. They just say you have one of that list. The chances of you having both 16 and 18 at the same time, which are in the vaccine, is pretty small. So what I have seen is that, you might treat somebody for complication from HPV. They do fine for several years. They get a new partner, and they have problems again. Well, what happened is they got a different strain. So even if you've had a colposcopy or a LEEP or treatment because of HPV and you know you have it, you still should get immunized.
Good. Can a person with HPV in the genital region transfer the infection to the oral region, or vice versa? Question.
Yes. What is happening is with oral sex, if women have HPV in their vaginal area and somebody has oral sex on them, then they can transfer it to their mouth. So that's how, in those studies with the mouth cancer with the boys, that's how they were getting it. Now, when I talk to classes, I say, boys, if you were ever going to have oral sex with somebody, you technically should ask them, have you had a pap test and was it normal? Well, who would ask, okay? So again, I just say the boys should just be immunized. And there are studies all regarding the incidence of teenagers having oral sex now, and the difference between 10 years ago and now is just astronomical. So a lot of teenagers nowadays just do not think that oral sex is sex.
Another question here. I heard that the vaccine only guarantees protection for 5 years. Do you have to get revaccinated after that?
With any vaccine, when it comes out, even like when we had the chickenpox vaccine come out initially, that was always the question, are we going to have to revaccinate? We won't know until the ongoing studies come out, and it takes time. So even as we speak, studies are going on to see in that initial study population, how is their immunity continuing. We all are probably aware that we've had to reboost for the MMR. We now have to reboost for whooping cough. So this is no different than those vaccines. We will know well in advance if they need a booster. Now, the real key is we just need to have these young people protected until they're in a stable monogamous relationship. Because once they're married and, not having any further partners and stuff, then it's a done deal. It's while they're having more than one sexual partner.
At what age should you start taking your child in for yearly pap smears?
That has changed. It used to be that when a girl became sexually active, that's when you came in for an annual pap test, and we would do them every year. Well, now there are, whenever there's any guidelines for any kind of a screening test, there are different groups who will have different recommendations. So you'll have what the Cancer Society recommends, what the Academy of OBGYN recommends, and so forth. I go by the Cancer Society guidelines, which state, and I have it right in front of me, and I can actually even read it from their site, all women should begin having pap tests about 3 years after they start having sex, but no later than age 21. So in girls who are not sexually active, they do not need to go in, and we used to say, 18, you have kind of a, you turn 18, you had to go in for a pap test. Well, now, if they're not sexually active, they can wait until age 21.
Okay, we have a question here lined up. Whoops. clarifying what you had said earlier. So just to confirm, HPV can be given to a woman orally by oral sex with a man. Is that correct?
That is correct.
And then related to that, does the man have to ejaculate for the HPV virus to transfer to the woman?
Yeah, and that is actually a very good point, okay? Now, diseases, sexually transmitted diseases are spread either through the ejaculate or skin to skin. So if you break them down into those two categories. So the ones that are spread through the ejaculate are gonorrhea, chlamydia, AIDS are the biggies, okay, and hepatitis. Now, the two that are spread by skin contact are herpes and HPV. Those are harder to prevent the spread because the ones that are spread through the ejaculate, the condom does help prevent the spread, okay? So HPV and herpes are spread by skin-to-skin contact.
Okay, now you say no side effects. Why have, I think, 18,000 adverse effects been reported to VAERS? Do you know anything? It's co-sponsored by the CDC and FDA.
Okay.
You know anything about that?
Yes. That's why I was pointing out the difference between, whenever you're doing a study on any drug or immunization, any complaint the person has gets recorded, okay, even if it's not really due to the medication, the vaccine, and so forth. And so that's why when you see medications being advertised on TV, and at the end you see this whole laundry list of side effects and that sort of thing. So anything the person complains of gets reported. And so what I was trying to point out is even if they injected somebody with saline solution, 28% of them complained of a headache. Okay, well, injecting somebody with saline solution really shouldn't cause a headache, but that gets reported. And so that's why you get these big laundry lists of potential side effects.
Question related to males again. Is there an HPV test for males being researched at this time?
That I don't know. Now, there have been studies out where they've actually taken swabs and swabbed male penises and have found both HPV and herpes on their penises. But those are really more in research centers. Those aren't in the general population.
If you get the HPV vaccine, do you still have to go in for yearly pap smears?
You would follow the guideline, and the concern we have with telling women that they don't need a pap test is then I'm concerned that they won't come in for gonorrhea and chlamydia tests. Because, okay, so we don't have to do a pap test on women for 3 years after they're sexually active. Okay, well, when they become sexually active, particularly if they're a teenager, they're at high risk for getting chlamydia. So they still need to come in our office for an exam so that we can screen them for gonorrhea and chlamydia. And a lot of people don't realize it, but we have a very high rate of chlamydia in Lynn County, and actually Johnson County and so forth. And I think one of the reasons our rate is high is a lot of kids around here just think we're just Iowa and we don't have to worry about things like sexually transmitted diseases. Versus if you go out to like New York City where they have a higher rate of AIDS, they probably are more accustomed to using condoms consistently. So in Cedar Rapids, in fact, I have a diagnosis of chlamydia almost every week in my office. And so they still, if they're sexually active, they need to come into the office because, for one thing, we need to be talking to them about risk reductions. We need to talk to them about birth control, screen them for gonorrhea, chlamydia, and so forth. So people often confuse the Pap test with just regular gynecological care.
Very good. Related to the study that we were discussing earlier, the question asked, so you're assuming the 18,000 people who showed side effects are completely wrong?
No, actually, when people report those side effects, they are actually feeling those side effects, okay? And those side effects can even come from anxiety, stress over maybe just being to the doctor or whatever. But for it to actually be a complication of the vaccine that would outweigh the benefits, that's what we're talking about. So anything we do to anybody, you know, whether it's a procedure, medication, vaccine, you always have to weigh the benefits of giving it or taking it versus the risk, okay? And so in this situation, the benefits of preventing cancer, you know, outweighs the risk.
Good answer. Girls get yearly gynecologic exams, and there's often a specialist involved. Should boys go to a specialist for yearly exams, or should their family doctor cover their sexual health in a yearly physical?
Well, there really isn't a specialist that would just treat males and screen them for sexually transmitted diseases. Urologists treat male gynecological problems, but they're more in the specialty realm, and you typically don't think of going to them to be screened for things like gonorrhea and chlamydia. So really the place for boys to go would be really their pediatrician or family physician.
Now, I think you covered this, but again, to repeat, how long do you have to get all 3 vaccines, from the time of the first vaccine until you're completely covered?
You have until you complete the vaccine series. Okay, so ideally you want to get them, you know, on schedule, but if you miss a dose, you do not have to start over.
And why can't you get all 3 vaccines at the same time?
The reason is because it takes time. When you get a vaccine, and if you recall, pretty much with most vaccine series, even whether it's your tetanus or whooping cough and so forth, you get your initial vaccine, and then you get a booster, and then you develop some immunity, and then you get another vaccine, and it boosts that immunity further. So each time you get the injection, your antibodies, which help fight that particular virus or infection, is increased.
Okay, if a woman has HPV, how can their partner be protected when having vaginal sexual intercourse?
Well, in a committed relationship, okay, you just have to discuss it with your partner. Now, the chance of your partner developing penile cancer is very low. Penile cancer is not a common cancer. I have never seen it in my practice. You know, if you look online or in studies, you know, there'll be cases in the United States, but it is not a common cancer. Now, the head and neck cancer is a different story. And this is a new thing because now, as physicians, we're going to have to start getting into much more intimate detail with our patients regarding their sexual behaviors. I do not know how you would prevent your significant other from getting the mouth cancer other than immunization, because again, the mouth cancer that you can get from oral sex is pretty much all HPV-16, which can be prevented with the vaccine. Well, you give the vaccine only to age 26. So what do you do if you're 32? I've had this question come up in my office, and I don't have an answer right now. You know, they would have to decide if they want to take the risk. I personally wouldn't want my husband taking the risk, but that would be something that you would just have to discuss with your partner.
Now, you talked about sexually transmitted diseases. Is that the same as sexually transmitted infections that we read about?
The term, when I was in medical school 25 years ago, we used the term STDs, sexually transmitted diseases. Then somewhere along there they decided to change it to STI, sexually transmitted infections. They're used interchangeably.
Well, I think we have covered the questions that have been submitted to us, but we'll wait just a little while here, give you a little bit more information that if you do have additional questions, please call 447-0990 and schedule an appointment with Dr. Bertroche. We have had another question come in. We need to scroll it down, though, so I can see the top part of it. Okay, so if a woman has been diagnosed with HPV at age 44 with a high-risk strain but low-risk abnormal pap smear, what are the chances of the HPV curing itself? And would you recommend monitoring via pap smears, or would you recommend a LEEP procedure? I'm kind of specific here, but okay. I'm sure you can.
Yes. Now, if the pap, I'm reading this, high-risk strain but low-risk abnormal. Okay, if your pap, most people, women who have high-risk strain of HPV, clear it on their own, 90% of them within a 10-year period. So if your pap smear is just slightly abnormal, and when I give some talks, I do show you the grades of a pap test, and I can just tell you now, your pap tests are graded on a scale of normal, ascus, which doesn't mean anything to you, a low-grade lesion, high-grade lesion, and then cancer. Okay, if you're in if you're in that first category in ascus, you definitely would want to just sit on it, because 90% of the time that's going to clear on its own. If you're getting into the low grade and above, then you probably should have at least a colposcopy. What a colposcopy is, it's another procedure is in the office. It's like a regular pelvic exam, but we look at the cervix under a special microscope and can see what areas on the cervix are actually infected. We do biopsies from those areas and then can determine from those biopsies whether or not you should have a LEEP or not. Okay. The LEEP typically does take care of it. We still would want to monitor your pap smears closer for a short period of time after you have a LEEP, but usually the LEEP then takes care of it. But if you're still only at one of the lower pap tests grades, I would just, probably hold off on the LEEP. Now, if you're...
Before we go on, can you tell us what the LEEP procedure is for people who might not know
Okay,
that?
what the LEEP is, it's also another office procedure where we take an instrument, and I don't do this particular procedure. My partners do, some of them. And we take an electrocautery device and remove the skin off of the cervix. So it's kind of like when you're treating a wart on your hand and you cauterize the wart. Maybe some of you in the audience have had that done. But basically we do that on the cervix because this is where the HPV is on the cervix. Your types of tests and treatment that you do for HPV are the PAP is a screening test. Colposcopy is kind of the checking closer to see if we need to do the final treatment, and the LEEP is actually the treatment to get rid of it. Okay. Now, if you're 44, so do you have your partner have oral sex on you? See, that's where the issue is, because I do not know of how you can prevent him from getting exposed in his mouth to HPV. Vaginal intercourse, again, penile cancer is pretty rare, okay? In my mind, I think the oral risk would be greater. Unfortunately, right now, he probably is not in an age group where he can get vaccinated. Down the road, I'm assuming the vaccine will be approved for older age groups, but right now it isn't.
All right, let's see if we have any other questions. Another one related to this. Dental dams work to reduce risk of transmission, or I guess do dental dams work to reduce the risk of transmission of HPV for oral sex?
I haven't seen any studies regarding dental dams. My assumption is that it probably would help, even just like the condom helps. But because we don't know where you're harboring this virus and it spreads skin to skin, nothing is 100% when it comes to these viruses. So the dental dam would probably help, but it is, I've never seen that they've said that it would actually eliminate the risk. And again, in young people, I think it is extremely important to still tell them they need to use condoms, because Gonorrhea and chlamydia are, in fact, even in my practice, which is not a high-risk population, my oldest patient who had gonorrhea was 56. I've had people in the upper 50s come in with chlamydia, and I think the reason is a lot of people around here just think these aren't a problem because, again, we're not a big city and so forth, so condoms are extremely important.
Taking the decision to make the safer sex.
Right, safer sex, right.
Another question, are there tests to check for HPV of the mouth before it metastasizes to the neck?
When I was giving this talk to these dental health professionals, the speaker before me was talking about some screening tests that are, the dental professionals are researching, but there isn't any test that's really out there, for general screening. In the studies I was reading, they said that that there really wasn't a good screening test for head and neck cancer due to HPV. Again, the reason is because there aren't any sores in the mouth. HPV gets into like the tonsils and would cause just very small cancers, and then it metastasizes before you actually have a visible lesion. I think that some of the dental professionals may do some like swishes or something like that to see if they can collect any abnormal cells and that sort of thing. But it's not, in my opinion, I don't think it's very accurate at this point.
In the early stages then.
Right.
The tape of this program will be available at www.mercycare.org/live, and you can check this website for additional information about future webinars. Our next webinar, information is on the screen, will be Tuesday, July 12th at noon with Luke Hansen from the Mercy Family Counseling Department. He will be discussing new strategies of coping with pain, and then we'll take your questions live after his presentation. I think, thank you, Dr. Bertroche. You've just given a wealth of information. We've had some very technical questions here for you. I believe we have covered all the questions that have been submitted. Do you have something else you'd like to add?
The one thing I would like to add is the state of Iowa has mandated to the school systems that they are to be teaching students about HPV and the availability of vaccines to help prevent it. I would encourage you to contact your schools, particularly the high schools, to see if they indeed are fulfilling that obligation.
Who in the school would they contact? The principal, the teacher?
I would call the principal's office first, probably, and then they would probably direct you to who would know that information. But a lot of parents think, well, this information should be just taught by the parents. But the problem is as you could discover just from me talking to you today, this is a very complicated issue, and it's not just a matter of throwing condoms out to kids. There's a lot of detailed information that young people should know before they make decisions regarding their sexual health. And I just think, if we give them correct, accurate information, then it's up to them to decide, what they want to do. But how can they make good decisions if they are given information to begin with? So I think information is powerful.
Probably the wisest words you said throughout the last hour. So again, if you have questions, call Dr. Bertroche to schedule an appointment, and her number again is 319-447-0999.